A new report raising concerns for children who are overweight and not just for health reasons.
Medical reporter Liz Bonas has that story now, shares details about why in today's Health Alert. Liz.
Good afternoon to both of you. This report found that while we know there are health risks for children who are overweight, such as an early risk for heart problems and lower self-esteem, this study says it could also hold kids back in school. And with more and more children hitting weights that are considered clinically obese, experts say we need to take a look at this as something that impacts academic success and maybe even what they call intellectual failure.
This study reviewed 77,000 students and found those who had higher grades had higher levels of physical activity. Grades actually went down when kids had more soda pop and more fast food. The kids who got A's and B's were more likely to have exercise in their daily lives, eat food that was healthier, and drink less soda pop. Based on this, researchers say elementary school kids need about 20 minutes of activity a day, and middle school kids need about 30 minutes of exercise a day.
Now, what's important to note about this is that it didn't pinpoint the weight as what would hold kids back in school, but rather an unhealthy lifestyle, a diet, activity levels, things that can influence everything from concentration to sleep habits. Say the soda pop has caffeine, you know?
Yeah.
So really what you're looking at, I have to say I was a little piglet growing up. I grew wide before I grew high. By the time I was in the 5th grade, my dad promised me $100 if I would lose 10 pounds. I mean, that's how big it was.
Not a
recommended
No,
thing.
I was chunky too. I'll admit.
Yeah.
I gotta,
so
yeah,
there's and you know, I worked hard in school and that,
Yeah.
but my mom said we're going to exercise together. So we exercise together.
It's just changing habits.
It is trying to keep a kid about the same size as they grow taller.
Mine was really simple. I just started liking boys, dropped the weight.
Really?
I'm
man.
serious. I mean, you know, I looked in the mirror.
I had brothers. I didn't really like boys for a while. Yeah.
What do you got
We're
coming
back
up?
in our next half hour to talk to you about some really unique things about women's health. I bet you haven't heard these risks and what you need to know about them.
All right, looking forward to it.